Welcome to Planetary Health First, Mars Next. It is an amazing day. We are here live at VIVE, and we have Dr. Gupta with Tembo Health. And man, this is so exciting. Where's the name come from? Tell me.
Hey, Michael, it's great to be here today. So Tembo Health, we're all about senior care. And so we were inspired by the name Tembo because Tembo is Swahili for elephants. And elephants are one of the few species on the planet that care for their elders in nature. And our mission is all aligned about keeping seniors healthy, happy, and at home.
Cool. Well, this is really a very personal, I have a father who's 91. He's on hospice. He has dementia. And I wish I would have known about your product before we went through this process because I understand this. We had a lot of multiple hospitalizations that really weren't necessary. We just don't do a good job in healthcare. And I really thank you and appreciate everything you're doing.
Yeah, no, thank you. I think all of us have personal stories, especially when it comes to elder care and aging care. My personal inspiration was my own grandfather. As my grandfather was aging into his upper 80s, younger 90s, just had a slew of chronic conditions, multiple open heart surgeries, as cognitive impairment kind of set in particular, that just created so many new challenges, both on the caregiving side of things and also in terms of coordinating the right health care for him. And my family really struggled with this. And, ultimately, he just had too many visits to the emergency room. Like almost every 4 to 6 weeks, he's ending up at the ER, at the hospital. Really, just emotionally draining for my family in that regard.
And it's hard because even though you're a clinician, you're a doctor, it still isn't working right. So where did you start from idea? Obviously, you had a personal journey. Tell us about your origins.
Yeah. So again, I'm an emergency medicine trauma physician with training in bioinformatics. My dad is a primary care physician. My sisters are both doctors. So you think if somebody could, figure out this system and get the right resource we need for my grandfather, we would be prime for success there. But despite that, it was a real struggle. And what I found was, and this is happening about 2012, 2014 arena. But especially back then, we couldn't find any meaningful solutions addressing the senior population, where you have meaningful technology and workflows built for seniors, for the family members and caregivers that are supporting that generation. And that was really my inspiration for trying to I've got the skill set, from the clinical side, the informatics side, the business side. I should do something about this. And, how do we really bring meaningful technology that is built specifically for seniors? And I think this, we were there way before, all these monikers for age tech and silver tech, became popularized.
And I think I saw something, stats, impacts, something like 75. You have some really cool, impactful statements. Can you get onto the data points?
Yeah. So we provide a virtual wraparound care model for dementia, which includes care navigation, telehealth, specialty visits. We have a 24/7 virtual ER. We've partnered with a bunch of mobile diagnostic companies to bring diagnostics into the home in terms of mobile radiology, mobile phlebotomy, and so forth. I think, in terms of statistics and outcomes, the three numbers that I'm most proud of, in order of importance to me personally, is number one is family engagement. More than 90% of the visits that we do and care visits that we do for our senior population, more than 90% of the time, the family members are participating live in those video sessions. That's just so important for us because to get the family's input, their additional data, information, context, and then to do shared decision making with the families as well in terms of what's the next step is, that's been such a critical component of our model. Number two, I would say is satisfaction rates. Our net promoter scores, historically around 100, anywhere from 95 to 99 month over month, which again just shows that there's a massive unmet need in this space. And then number three is on the clinical side. We for the last 3 years now consistently are showing a 75% reduction in emergency room transfers and hospitalizations. And this is an elderly complex population. Our average age is about 83 years old. 80% of our patients have dementia. So we do have some folks with more early stages of cognitive impairment and so forth, and just multiple chronic conditions. So It's a tough population.
Well, man, I'm blown away. For those, I'm not a rocket scientist, but I know what an MPS score, and for next to about 100, it's almost like, let me see the data.
Yeah.
Because it's just, what is like a good indicator? Even if it's like 30 or 40% is fairly decent. I mean, like the airlines probably have what, like a 11% MPS? I don't know.
Yeah. No, that's great. So Net Promoter Score, you basically take all the people who would say, would you refer your service, would you refer Tembo to your friends and family, That's kind of a Net Promoter Score. And you take all the positives and you subtract all the negatives from that to get that Net Promoter Score. So the range is actually negative 100 to positive 100. I'm not like super accurate on these numbers, but like I think in general, the healthcare industry strives for an NPS of 30 in terms of like hospitals, emergency rooms, doctors' offices, and so forth, which I think is an interesting low bar that they're striving for 30. I think if you look at the industry out there, some of the best NPS scores, I think Apple is around 70, and that's considered world class. I know the last time Tesla published this, at least a couple years ago, their NPS was like 90, and that was considered kind of unheard of in the consumer space. Yeah.
I think also it's from the journey, the family, the caregiver journey. You're providing hope that didn't exist, and that like, wow, all of a sudden they have you, right?
Yes.
So that's what we call product market magic fit, right? Or something, right?
Yeah, no, it is. I mean, and I think it's really, we're there all the time. We have 24/7 texting with our care navigators, and our care navigators in general are having 1 to 4 touch points per month with the family and caregivers for those patients with dementia that we're managing. So
who are your customers? Is it health plans? And then like, that's one thought I would want to get while we're here. And then the other thing is also like AI. I'm curious about that because we all talk about AI.
I can talk in depth about AI. So in terms of customer channels, as a startup for the last few years, we've been focused on working with senior housing, where you get a lot of these seniors that are living there. So we work with memory care communities, assisted living communities, independent living communities, to really just bring that element of healthcare to that lens. Because senior housing is typically focused on housing, activities, meals, social engagement, and so forth. And so we're really bringing that healthcare expertise to that industry, and that's been a great place for us to kind of cut our teeth, really learn how to work with these more complex patients, the caregivers, the multiple dynamics involved with families and primary care physicians and so forth. And we continue to grow in that space, but we're now really trying to shift more towards value-based care. So we're now working with Medicare Advantage plans, health plans, provider groups and health systems that are taking risk like ACOs and so forth. And, we also launched a DTC channel recently. We're not focused on that per se, but we always get requests from folks like, my mom or grandma would really benefit from this, or have a friend whose parent or someone would really benefit from this. And we used to always say, well, you got to live in one of these buildings or go through one of these health plans, otherwise we can't really work with you. And, I just said, why don't we just at least make it available? And so we had some really good organic growth there, just from word of mouth, referrals, and so forth. And we have a website, but we're not really doing the SEO yet on there, because we're really focused on B2B primarily.
And then AI, are you anything on that?
Yeah, so in terms of AI, we're really big on collecting data, right? So we have all this robust data, longitudinal data on all of our patients. And then one thing that we launched about a few months ago were these kind of like invisible sensors. So you may be familiar with like remote patient monitoring types of devices.
So like LiDAR maybe? Like some of
yes, exactly. So these are millimeter wave technology sensors. It's about the size of a hockey puck. You put it on it's really simple. You peel a sticker off, you stick it on the wall above the bed, you plug it in, and that's the installation process. There's no logins, passwords, nothing to touch. Where from that hockey puck on the wall above the bed, I'm collecting your mom's heart rate, respiratory rate, sleep quality data, sleep duration data. We're actually getting about 250,000 data points per patient per month. We then take all of those data points, those hard vital sign data, we combine it with the medical record, and then using that combined data, we're able to run some machine learning algorithms and proprietary algorithms that are allowing us to detect early signs of infection, trauma, depression, agitation, before anyone else even knows that something's going on.
Well, this has been great, Dr. Gupta. It's so awesome to have you live at VIVE with Planetary Health First, Mars Next. We have this kind of interesting thing we've had a few, but it's reimagine healthcare. Bring a friend. That's our new series. Is there anyone else that you can imagine beacon out to the universe that you'd love to have a discussion, that you'd like to call out and maybe have on next time with us?
That's a tough question. I feel like I could come up with hundreds of folks
right.
I'd love to kind of bring on and
Well,
showcase.
maybe we'll just have to have you
Yeah.
on next, and
Okay.
we'll do just the beaconing out. How about that?
Yeah, let's do it. I
All
love
right.
that.
Awesome. Thank you so much.